Hello everyone, you're welcome to my channel. This is Dr. Tinwade on sexually transmitted infections. So today I'll be talking about normal vaginal discharge. If you have not subscribed to my channel, please do so that when I drop any new video, you'll be notified. So before you talk about the normal, you have to know the abnormal. My spiritual father said that know the normal so well that when the abnormal comes, you will identify it. So we're talking about the normal today. Sexually transmitted infections will produce abnormal vaginal discharge. But know the normal and you'll be able to identify the abnormal. But before I talk about the normal, let's talk about the vagina. Because a lot of people confuse vulva with the vagina. Vulva is different, vagina is different. The outer part that we see is the vulva. And the vagina, the opening of the vagina is on the vulva. The opening to the bladder too is on the vulva. And on the vulva too, we have the upper part that is covered with hair. That one is called mons pubis. Then we have the downward side towards the anus. That's the labia majora. The inner one, the inner circle, that is called the labia minora. So that's the vulva for you. But the vaginal orifice is close to the anus. So that is why we tell people don't wash from your anus into your vagina, because if you do so, you can transfer bacteria. You can transfer bacteria from the anus into the vagina, and that is not too good. And the vagina itself is around 3 inches long. In most people, it can be oval, it can be circular. So that area where we insert the penis is actually the vagina, not the outer parts. And the way God has made the vagina, we have glands there. So those glands produce the secretion we're talking about. Then we have what we call glycogen there. And there's a bacteria. We call that bacteria lactobacillus. What that bacteria does is that it will ferment the glycogen to produce lactic acid. So that lactic acid will give the vagina the acidic environment. So the vagina, what we are saying is acidic. And that place is what keeps the vagina healthy, because it's acidic. It will prevent those bad bacteria from growing and the vagina will be healthy. But a lot of things we do actually that will kill lactobacillus. One of it is, women, sometimes you feel your vagina is not smelling the way you like it, or you just feel somehow. So people will go, they use antibacterial. Some people will go use antiseptic soap. Some will go this feminine hygiene product. They want to wash that place, clean it so that that place will be smelling nice. But when you are doing that, you are killing the bacteria that God has put in that place. And when that bacteria is dead or the number is reduced, you have other bacteria that will go and they are not good for the vagina. So by the time you are having sex, and after having sex, you will smell this rotten fish odor. Know that there's a problem, because there's a condition we call bacterial vaginosis. That condition, why do we have it? Is when we have an imbalance in the environment of the vagina. The vagina that is supposed to be acidic is no more acidic. So by the time you're having sex, you have that smell. So if you have that smell, come to the hospital for treatment. That is not too good for you. Your spouse might even be complaining. There are people that come home, my spouse doesn't want to have sex with me because after sex, there is this bad odor. Vaginal discharge is not meant to give bad odor. Though it has a smell, but it's not a bad one. So by the time you have like a rotten fish smell after sex, there's a problem. Come to the hospital for treatment. So vaginal discharge, the normal one, is actually clean to clear. What I mean is that when you see it, it's like white or it's clear in color, though it is not homogeneous, because there are things we call epithelial cells. Those ones too, they will shed into those secretions. So it's not like it's homogeneous, but it's like clear to white. Then it doesn't stick to the wall of the vagina. It doesn't stick to the wall of the vagina, and that means it comes out easily. The normal vaginal discharge comes out easily. It doesn't stick to the wall of the vagina. It doesn't give a bad odor. The odor it gives actually is from sweet to metallic, because of the metabolism taking place in the vagina. Like I told you, there's lactobacillus fermenting glycogen, giving lactic acid. So all those processes will give a kind of smell, metallic to sweet, but it is not a bad odor. So by the time you're having a bad odor, there's a problem. There are two main conditions actually that give vagina discharge this bad odor. Is the bacterial vaginosis that I've spoken about, when people begin to kill the bacteria in the vagina, the lactobacillus, and when people are infected with a parasite called Trichomonas vaginalis. It's a sexually transmitted infection. We call it trichomoniasis. So that too gives a bad odor, and that is not normal. But the normal is, let me just summarize how the normal looks. It is clear to white. It is not homogeneous, actually. It's not homogeneous. It doesn't stick to the wall of the vagina. It doesn't give a bad odor. Though during some period of our menstrual cycle, the discharge can be increased. During ovulation, it can be more. During the premenstrual period, between ovulation and your menstruation, it can be more. When people are pregnant, it can be more. When people are on OCP, it can be more. You know, there's this funny thing that always happens. Some people, when they come to the hospital complaining of abnormal vaginal discharge, even after investigation, you get to know that the discharge is normal. But because what I noticed that some of them, they've done some bad things. Maybe they've gone to have casual sex, they've gone to have sex with other people that is not their spouse, and they are scared. So they come to the hospital, doctor, this, that. And by the time you take those secretions to investigate in the lab, you know, there's nothing wrong with them. Some of them, even they will not believe you. So I just think is guilty conscience anyway. But what I'm just trying to say is that vaginal secretion can be normal. It can be normal. Vaginal secretion is not always abnormal. Every female, so far you have reached the puberty stage, you will have vaginal secretion. It will come. It is more during ovulation. When you use OCP, it is small. So we have what we call normal vaginal discharge. So don't be worried when you're having discharges. Just make sure it is normal. When it's not normal, you can come to the hospital. Actually, there are three main conditions that causes abnormal vaginal discharge. I'm still going to talk about that. But today, I'm just talking mainly on the normal vaginal discharge. And this is just a quick one. Next time, we're still going to talk more on sexually transmitted infections. I need to go. Love you all. Bye.